I was in an accident July 24th. It was a Thursday night, and I was the passenger in a vehicle, and the driver turned onto a gravel road. And the truck flipped, and it caused me to be ejected from the vehicle. I was conscious. I landed on the ground, and I instantly knew I couldn't move my legs or my arms. So we ended up sitting there for a couple hours before someone was able to get called. From there, I was sent to the county hospital. Then I was sent straight to Iowa City.
Russell Evans came to us from the University of Iowa after having a motor vehicle accident. They had to bring him to a local hospital where he received stabilization and a confirmation of his condition, and then transferred to the University of Iowa, where it was confirmed that he sustained a spinal cord injury with injury to his spine as well as a spinal cord.
When Russ had his accident, we really had no idea what we were in for. And I can remember when he came out of surgery, I'm known for dumb questions, and I asked the doctor, who was the liaison between the surgery room and the patient, that I asked him if Russ would walk again. And he just looked at me and he said, I'm glad he's alive.
Level he was at was pretty significant. He could barely move his hands, and he had little to no movement in his legs. And his prognosis at that point in general was not very good. Before people come to Genesis, we have to screen how they're doing in the acute care setting, which he received those services at the University of Iowa. And that allowed him to be eligible for a study that the University of Iowa was involved with in conjunction with Genesis. That allowed him to receive an infusion of a medication that was to help with a spinal cord injury. Part of the benefit in coming to Genesis is that we have a program that provides recovery from spinal cord injuries under a system of care. Genesis has a stable core of key clinicians that provide the consistency of care.
Genesis is the only CARF accredited spinal cord injury program in the state of Iowa. One of the things that we feel like is a big asset for us here is that we provide one-on-one therapy. A lot of the model centers actually do provide one-on-one therapy, but have a lot of groups.
We conduct focus groups twice a year where we bring in former patients and interview them regarding their therapy and what they liked, areas of improvement. And one of the things that they consistently state is they like the one-on-one therapy that they get here at Genesis.
The whole team is great to work with. Very, very flexible, very knowledgeable. We can talk with each other, and I think it's a real, I think a pretty cohesive unit. So when we can stay that way, we're more focused for Russ and for other spinal cord patients.
With all of our spinal cord patients, in learning about their condition, we have a manual that we use called Yes You Can. So as part of Russ's daily speech sessions, he had to read aloud from that book, and then we had him retain and recall what it was he was learning.
For the spinal cord program, we have an interdisciplinary approach, whereas we meet every week, the doctors, the therapists, the nurse, and myself, and we discuss the patient's goals, things that they've met, their strengths and their barriers. We review those each week to make sure that we're all headed in the same direction and on the same page.
Russ's rehab journey we knew was going to be a long one. Like I said, we really weren't sure what to expect when he ended up coming to the unit. He was only able to tolerate about 2 hours up in the chair in his therapies, and so we had that extra hour that we ended up seeing him bedside in his room because of his low endurance and inability to tolerate standing.
When he first started standing, he had issues with his blood pressure, which is typical with a spinal cord injury. He required his legs to be ace-wrapped and a binder around his abdomen in order to help keep his blood pressure from dropping. From standing, then eventually as he got stronger, we were working on strengthening exercises.
He was motivated from day one. He worked very, very hard, was an overachiever.
Genesis, they pushed me a lot. They have great knowledge about spinal cord injuries and about what one should be able to do and how to progress by making adjustments to their system to fit my needs.
Fortunately, he was able to improve enough to where he was able to walk again and walk with less and less braces and not have to use a walker or a cane.
In occupational therapy, I saw Russ for at least an hour and a half, sometimes longer, every day. I saw improvements every couple days, if not daily. It was just absolutely incredible. I look at the amount of time he was here with us, which is approximately 8 weeks, and I have never seen in my time of being an occupational therapist someone progress so nicely.
You know, healthcare is all about hope, and you know, when people come to a hospital, I think they're looking for comfort and they're looking for hope, and that they'll be better the next day than they were today. You know, slow but sure. Russ, I think, kind of sensed that as he started to feel his system regenerating and that there was hope here that he would walk again. Fourth Floor Genesis was very good to Russ on personal basis and professional. There's little doubt in my mind that it would have been as successful in another setting.
Great to see you. Look fantastic.
Genesis has taken the lead to provide academic level of rehabilitation care here in the community, and that makes Genesis unique in that regard, and it shows the commitment that Genesis has for disabled patients in the community to provide top care, not just average care, in making this commitment for spinal cord injury system of care. What's unique about Russell is that how fast he improved and how much he improved is what's remarkable about his recovery process, both from his determination and possibly from the research medication from the study that he participated in.
The whole team, the nurses, the therapists, the research nurses that came from our research center here at Genesis, all came together to provide the best care for Russ, and he did indeed have a wonderful outcome, which was very exciting for all of us.